Hello and welcome everyone. Today we're diving into a topic that's often misunderstood: attention deficit disorder, or ADD for short. This neurodevelopmental disorder is not exclusive to children. It affects adults too. Imagine trying to focus on a task, but getting easily sidetracked, or feeling restless and acting on impulse without considering the consequences. ADD is characterized by these challenges. Those with ADD experience significant difficulties with attention, which can manifest as forgetfulness, distraction, and struggles with following through on tasks. Impulsivity is another key feature, leading to hasty actions without enough thought. Lastly, hyperactivity often presents as an excessive energy level, making it hard to sit still or engage in quiet activities. These symptoms can interfere with everyday life, making it challenging for individuals to perform at work or school, maintain relationships, or manage daily tasks. Remember, understanding ADD is the first step towards managing it effectively. Now that we know what ADD is, let's discuss some of the most common symptoms. When we talk about attention deficit disorder, or ADD, we often think about difficulty focusing. This could mean trouble staying on task, easily losing track of time, or getting lost in thoughts. But that's not the only symptom. Forgetfulness is another common indicator. This might look like constantly misplacing items, forgetting daily tasks, or struggling to keep up with a conversation. Impulsivity is another symptom to watch for. This can mean acting without thinking about the consequences, interrupting others during conversation, or having difficulty waiting for their turn. Lastly, hyperactivity, although more associated with ADHD, can also be present in some cases of ADD. This may show as excessive fidgeting, restlessness, or non-stop talking. These symptoms can interfere with daily life and functioning, making it challenging for individuals with ADD to navigate their day-to-day activities. Recognizing these symptoms is crucial to getting a correct diagnosis and the right help. But what causes ADD? What are the risk factors? Researchers are still exploring the exact causes of attention deficit disorder, but there are several factors that may play a role. For starters, genetics is a key player. Studies suggest that ADD tends to run in families, indicating a potential genetic link. Another potential cause is brain injury. Certain injuries to the brain, particularly those affecting the frontal lobe, have been linked to ADD. However, it's important to note that most people with ADD have not suffered a brain injury. Environmental factors also come into play. Exposure to certain toxins like lead during infancy or in early childhood can influence brain development and potentially lead to ADD. But remember, there's no single cause of ADD. It often involves a combination of these factors and others that research may yet uncover. Knowing the potential causes and risk factors can help us better understand and manage this disorder. Having ADD doesn't mean you can't lead a successful and fulfilling life. Let's talk about how it can be managed and treated. Treatment for attention deficit disorder, or ADD, isn't one size fits all. It's a journey of trial and error, finding what works best for the individual in question. It generally involves a mix of medication, therapy, and lifestyle changes. Medication, often the first line of treatment, can help improve concentration and focus. Some of the most common types include stimulants and non-stimulants, each with their own benefits and potential side effects. It's crucial to work closely with a healthcare provider to find the most effective and tolerable medication. Therapy is another critical component in the treatment of ADD. Cognitive behavioral therapy can help individuals learn skills to manage their symptoms better. Family therapy might also come into play, providing support and strategies for the entire family to cope with the effects of ADD. Lifestyle changes can also make a significant difference. Regular physical activity, a balanced diet, sufficient sleep, and minimizing distractions are all proven to be beneficial. Mindfulness practices like meditation and yoga can also be helpful. Remember, each person's experience with ADD is unique, so what works for one might not work for another. The key is to create a personalized treatment plan, rooted in patience and understanding, that addresses the individual's specific needs and challenges. With the right treatment and support, individuals with ADD can thrive. We've covered a lot of ground today, from understanding what ADD is, recognizing its symptoms, exploring its causes, and discussing treatment options. Remember, knowledge is power. The more we understand about ADD, the better equipped we are to support those living with it. Acceptance and empathy go a long way. Thank you for joining us today. If you found this video helpful, please give it a thumbs up, subscribe to our channel, and leave us a comment. Let's continue the conversation about ADD. Until next time, take care. Take Before we wrap up, we'd like to remind you that this video is intended for informational purposes only. It is not a substitute for professional medical advice, diagnosis or treatment. Always seek the advice of your healthcare provider with any questions you may have regarding a medical condition. Moreover, never disregard professional medical advice or delay in seeking it because of something you have heard in this video. It's essential to consult with professionals to ensure you're getting the right help. We hope this video has been informative and helpful. Thank you again for watching.